chapter, processing an insurance claim. So we talked about this several times. We didn't discuss the whole, detail um, chapter, but we've been talking about how to process an insurance card. We're going to talk about those steps. Um, we're going to talk about the importance of documenting again correctly entrance and entries within the medical record, keeping the medical record complete, um, coding and assigning the correct, codes to the procedures, to the evaluations from the medical doctor, any treatments that the patient receives during the time of the visit or at stay if it is in hospitalization. So basically, that's what it is. We talk about that there is a form, very common form that we're going to be discussing, CMS 1500. I have already emailed you the chapters for this last part of the course, as well as a link for you to get an electronic CMS 1500. This is a editable kind of form that you can use if you want to learn a little bit. It's not part of the program, but if you want to go and trying to learn it, it's not difficult. The information is there. I can send you all the steps how to fill that application if you want to. But again, for the purpose of this course, for the purpose of the exam, you just need to know what forms do we use and which forms do we use in outpatient settings and inpatient. So that's basically what it is. And which part of these forms um, correlates with the patient's information, and which part of this form is the medical provider who has to enter all that information. So there are two parts. We're gonna go back, we're gonna go there in a few. So for now, let's get some objectives for this course and some definitions and more details about how to process an insurance claim. All the steps that we're gonna go through from the moment that the patient signs in, registered with our office for the first time, and then the procedures that the patient receives, the evaluation that the patient receives, diagnosis, then we're going to move to enter, process all that information from the medical records. We're going to talk about the encounter form or the charge slip, because that's basically what we're going to use for the purpose of the exam, most likely. So then you're going to fill the application, or whoever is going to fill the application in the billing department. Then they're going to submit the application. And if there's any errors, anything that the insurance company think is not correct, they're going to send that form back to you for corrections. So it's going to be rejected. You got to complete it. You're going to fix it and send it back. If they reject it again, then you're going to appeal and you're going to submit any information that is relevant to the application to see if qualifies for insurance. Otherwise, the medical provider is going to just lose that money. We're going to see what some of the reasons why we don't get paid. Why is it that this application or this insurance claim didn't go through? And how to avoid that from happening, how to prevent, let's put it that way. And that is it. We're going to know some of the parts of these forms, particularly the claim that is the most common, which is the CMS 1500. And we're going to see the application, we're going to see the form, so you're going to have an idea what we're talking about. Okay, so let's move on the objectives for this class. We're going to describe the processing of the insurance claim. Remember, we're going to focus mostly on the outpatients because it's the most common form, and it's the most common form that is being asked for examination. If they ask you for the inpatients, we mentioned that already, but I will mention it again so you can keep it in mind, just in case they ask you which form is used for inpatients or hospitalized patients, because it's totally different. We don't use the same form. Remember, this is like medical records. The patient in an outpatient clinic, that medical records is going to be used every single time the patient comes for services to in our office. But if the patient is admitted, this is not the medical records that is going to be used. We're going to open a different one. If the patient is taking care in the emergency, we're going to open a new medical records, and every single time the patient is admitted, every single time the patient goes to the emergency, we're going to open a different medical records. So that's basically what it is. Later on in other chapters, we're going to talk about another reason why another medical record needs to be stored. So we do not use the same medical records when you're PCP or primary care physician, and the reasons why. I'm going to explain the patient's records and claims processing for a new established patient because it is a little different. So again, I'm going to talk about most likely is what is a new patient, what is an established patient, and how do we go about to fill out these or to complete these applications. In a little glance, we're going to talk about how to manage the insurance, the office insurance finances, meaning receivables, accounts receivables, and accounts payable. So, because it's going to be on your exam, just a little bit. We're not going to go too much in depth, but I do want to cover this because you're definitely going to have on your exam. We are going to talk about the life cycle of an insurance claim, meaning from the moment that the claim is completed, sent to the insurance, how long it takes for us to get paid, or what to do during the process. How do you check? How do you track the status of that claim? And what I mentioned before, what happens if the insurance is being rejected, if the claim is being rejected? What are we going to do? And when do we appeal? And what information is being sent to the medical doctor? What information is being sent to the patient from the insurance company if the bill is paid or the bill or the claim is not paid? So that's basically what. So it's very, very important because that can be helpful to you, because if you have a health insurance and you encounter yourself in one of these situations, you know exactly what happened when, the insurance company not necessarily is going to bill you, but the medical office is going to bill you if the insurance does not pay for the services. Because that's what you signed for when you completed the registration for the first time. Remember, you are responsible for the payments. If the insurance doesn't pay, the patient is always responsible for it. And if the insurance pays part of it, you are responsible for the balance. And if the insurance doesn't pay anything, you are responsible for the whole amount. So that's basically what it is. And one of the major reasons why you need to know this is because you are going to have these patients coming over the office and asking you, I received this bill, I'm not going to pay it. The insurance was supposed to pay. So instead of getting into an argument or anything else, if you don't know the answer, not a problem. Refer this patient to the billing department. They are the ones that can handle the situation. But sometimes it's something so easy that even though if you're not the person from the billing department, Still, you can answer and save some time and some headaches with the patient. I will talk about that later on when we get to those topics. So after we send all these claims and we receive them because we receive payments from them, we have to maintain these claims for a certain period of time. Remember that every single legal document within the medical records of the patient has some type of statute of limitation. So some time in which these files or records needs to be maintained. After certain limitations, according to each state, you might have to get, rid of them without any penalties. So you can't just by yourself decide I'm going to get rid of the medical records, or I'm gonna get rid of all these insurance claims that has been paid or not. You can't just say, oh, they pay me for this, so I don't need it anymore. This is like when you purchase something and you think that everything is okay and you throw out the receipt. Well, what's gonna happen if you have any issues with the items that you purchase? Where are the receipts? So if you don't have the receipts, then you can have trouble trying to, fight for reimbursement or repairment or whatever the case may be. So that's basically what it is. So that's something that we need to keep in mind all the time because this is legal documents and legal documents are need to be kept for some period of time. Think about your driver license. Think about your passport. They are legal documents. They need to be renewed. And if you lose them, then you have to report it. If you driver license got lost, you have to report it. If your passport got lost, you have to report it because otherwise it becomes a liability. Somebody else can impersonate you or use your identification for other purposes. Of course, it's not going to be a good purpose. You're going to be responsible for it if you do not report all these situations. So that's the same with medical records. Anything that happens there, we have to report, we have to keep it for a certain period of time to meet all the regulations which are from state or federal laws. So that's basically what it is. So this will be the objectives that we are going to be covering. So what is it that we are going to be reviewing, covering during this chapter? How to process these insurance claims once again. So who does it? From where do we get this information? And who's responsible to complete these claims? So that's basically what, and to who are we going to be sending this? Through which modes of transmission? So back in the days, we send them in the mail. So it will take a long time for us to get the reimbursed. Now, everything is done electronically. So we're going to talk about that. What are, the modes of, transferring this information from our office to the insurance company. The whole process cycle that's going to take the claim from the moment that we send it from our office, that we complete it, until we get paid or our claim is rejected. So that's basically what we're going to be talking about. So how do we initiate this claim? The claim initiates from the moment that the patient creates this relationship with the medical provider. If you remember the first chapters when we talk about medical records, when we talk about communicating effectively with the patients, scheduling appointments, because you might have a new patient. So that's exactly what we're going to do. Immediately after we establish this relationship with the patient, which is the patient joins our clinic, our hospital, our institution. So at that particular moment that the patient makes the appointment to meet with the doctor, the insurance claim starts. It's not that it starts running for us to cover. No, this is one of the patients that as soon as the patient comes into our office, we're going to bill the insurance company for the services provided because we have a new client. This is like when you have a new client that places an order in something. We know already that that's our client. We already going to be shipping that particular item that has been purchased. The same with our patients. Our patients are not items, but our patients are clients. So they come to our office, they make an appointment. Now we're going to bill for those patients. Now, forget about thinking, oh, what if this patient doesn't have health insurance? We're not talking about that. Remember, we're always going to remove things that do not pertain to it. Oh, I want to display, but I don't have insurance. So how are they going to start the claim? How does that work? That doesn't apply. The only time that a processing of an insurance claim initiates is when the patient has a health insurance. He or she has contracted with an insurance company. Now we're going to bill that insurance company for the services provided, regardless what services the patient is going to receive in the office. So that's what we have to think. Remember, as an adult or as adults, we tend to reflect into things that we have experienced. So for that reason, for adults, it's a lot harder to learn things because it's not the first time you've been exposed to certain things. So you use the things that you were exposed to it about insurance or what you heard or what you read or what you saw in the news, and then you put it into your plate. Well, for these courses, please, and for the exams, do not involve anything that you have learned from prior experiences. Going to the doctor, somebody else's story about the insurance, or how they pay, or how they receive a bill or not. Don't think about that. Think that this is totally new for you. Remember, that is the reason that for us as adults, it's a lot harder to learn things. Because as soon as I start saying something, and you probably already, your mind start flying everywhere, thinking about, oh, yes, I remember when I went, oh, this sounds like that. It is good that we have a little understanding, but don't let this understanding to carry you away, because then you're gonna mix up your own experiences with the truth. Because this, what it is in these chapters, is exactly how it is. Anything else is how you interpret that or how your situation was, because you did not know anything about insurance or about any of these subjects that we are discussing. Remember, I like to go over this because we tend to mess up with exams. I'm telling you based on my experience. I remember something, I said, oh, this question is more like that. So, oh yeah, I heard this, so it's gotta be this. Well, don't go by that because then you're gonna pick the wrong answer. It's what I'm telling you, what the books tell you, that's exactly what it is. The people change things around, that's a different issue, but that's how you interpret them. But your interpretation is not how it's written. So we gotta learn the things in a different way. So that's basically what I'm trying to tell you. Because I'm being there, I know that I have experienced most of my students prior that they have made mistakes. It says, "Oh, professor, but I know that this is this and that about any of the subjects." I say, "Yeah, that's what happens to you, but it's not the reality. That's what you think it is, but in reality, that's not what it is." Because whatever experiences that we have, it's not sometimes doesn't give you an explanation of the real thing. So once again, just don't get distracted. So now where are we going to get this information to complete that claim? There is one document. It is within the medical records. It's not that we're going to go and read the entire medical records or whatever history the doctor has taken. No, there is a form that the medical doctor is going to complete. And that is the only one that we're going to use because that form is going to summarize all the evaluations, all the procedures, diagnoses that the patient received during that particular visit. Remember, we bill for each visit individually. We don't collect every single visit from the patient the whole month or the whole week. Oh, well, we're going to wait. This patient probably is going to come twice this month. So we're going to wait until the next time and we're going to add it to the next bill. No, that doesn't work. Each visit, the patient is going to have one of these encounter forms. And for each patient, we are going to process one insurance claim every single time the patient shows up in our office or hospital. That's how it is. What is the name of that document that we're going to use? Where the medical doctor summarizes everything that the patient went through during that particular visit. That is called an encounter form. It is here in yellow. Please do not forget because this is 100% question on your exam. They're going to ask you, and they're going to ask you more likely like this. A patient comes to see the doctor. So the patient goes to the waiting area and the medical assistant has to ask the patient, okay, so we are going to bill you. And then says, yeah, I have my insurance. What form is it that you are going to be pulling out to complete the insurance claim? That is basically what it is. So they're going to ask you, the patient just came, was seen by the doctor. Now the patient has to be billed to the insurance company. Which document are you going to use for that purpose? That is called an encounter form. Encounter means I interview with you today. That's basically what it is. It is called an encounter bill, an encounter form. Now it's called also the super bill or the charge slip. Has three names. The general name that we use is encounter form. That is the most common name. But certain doctors in certain billing departments, they call it the super bill, the charge slip. So when you see any of these three words, you need to know that this is the document that the medical doctor completes every single time that a patient visits with the office. And this is what we use to send to the billing department so it can be used to complete the charge slip or to complete the insurance claim. That's basically what it is. So this is the document, the encounter form, super bill, or charge slip. Because they have another question where they ask you, oh, the encounter bill is also known as, then you say, oh, I look for a super bill or charge slip. Remember, that's how they like to ask questions. So for that reason, I like to kind of play around with these terms so you familiarize yourself. And not only that, someone can come to your office of course, from your office, someone who works in the billing department said, hey, can I see the encounter form for this patient? Or can I have the super bill or the charge slip? Immediately you know what is it that they are talking about. At least you heard that. That is totally different from, sometimes they ask us about something. I never heard that word before. So I have no clue. It's not that you're gonna kind of, remember every single thing every single time someone asks you about that. Oh, yeah, I heard that, but I never seen it before. So what is it? Can you explain it to me? So then you get a little more information. Oh, is that form? Well, with the doctor documents all the services for the patient, the codes are there, the diagnosis, blah, 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 blah. This says, oh, I know that. So that's basically what it is. Remember, that's the encounter for a super bill or the charge slip. Remember, one of the most common forms, this is another question for your exam. One of the most common forms used for processing insurance claims is the CMS 1500. Think about that. What does CMS stands for? Now, remember, this is Medicaid and Medicare services. Has to do with Medicaid and Medicare. This is Centers for Medicare and Medicaid Services. Because this is the organization that controls billing, controls expenses, expenditures in your hospital. If you have money that is being given to, money from the government. So these are the organizations. So for that reason, the claim is called the same because it's mostly used. It is used for every single charge, but again, it is a government form. Now, the forms from private insurances, the name of the private insurance is there. It's going to say, okay, so Blue Cross Blue Shield, they have the title. They're going to say Oxford. If it is the private part of the United Healthcare, so it's going to be United Healthcare, not the HMO. So any other forms for private insurances, they're going to have their own logo, their own letterhead, so to speak, in the form that is customized for each insurance. But this is the form that is used for most of these governmental organizations because this is the one that pays by the government. So if it is Medicare, Medicaid, and all these insurances under Medicaid, Medicare, they're going to be there. So that's basically what is so common. Why? Because many people has these insurances. So for that reason, we're going to use it a lot. So CMS 1500 is the most common form, remember. And this is mostly for outpatients. We will discuss that later. So we're going to need this encounter form, super bill, or charge slip in order for us to complete and process that insurance claim. Now, that insurance claim is going to be complete by someone who is hired by that particular institution. This is not the insurance that pays for it. No, this is someone, a doctor's offices, a doctor office contracts with an insurance a billing department, or they have their own billing department if they are a large institution. So this is someone paid by the office. This has nothing to do with insurance. They are like the middleman. So that's basically what it is. Some hospitals, remember, because they are a large corporation, they can afford to have billing department. So for that reason, the billing department belongs to the hospital. Doctors' offices do not have a billing department. They contract with these outside, uh, you know, billing and coding processing companies. And They pay them so they can run their billing for them. That's basically what it is. So this is an encounter form. Now, it's not like every single encounter form is going to be the same, but this is an example of what an encounter form looks like. So most of the information here is the patient information, and then the medical doctor is going to fill in all these whatever services has been provided, and the codes are there. So the diagnosis, generally, if the doctor is good at it, they some of the diagnosis, they memorize them. They are been dealing with this diagnosis for so many years that they just put the diagnosis. But most of the time, to be on the safe side, the medical doctors, they just write it down. Diabetes type 2, hypertension, essential hypertension, secondary hypertension, malignant hypertension, arthritis, osteoarthritis, rheumatoid arthritis. So whatever the case may be, the medical doctor is going to spell it out. Why? Because some of these diagnoses have different different prices. Let's put it that way. So different ways of paying the doctor. It's not like patient has diabetes, if we're just going to put, oh, diabetes. No, that doesn't work that way. Might be diabetes, might be first time diagnosed with diabetes, might be related to diabetes, the condition that they have. So we have to be very specific. That's what the billing, particularly coding, is very complex. It's difficult. Has to be done by someone who was trained at least 2 to 4 years in school, just doing codification, because this is the financial part of an office. So this is the form that you need to give it to the billing department. It's not the medical chart. It's not, oh, take the medical records and do it. We use the medical records as a reference when we do not understand something that is written here in this form. Then for reference purposes, you go there and see or request for that day that the patient was at the office to see what other information the medical doctor collected. Because here is not the whole information, it's a summary of what was done, what was ordered during that day. So sometimes we find some discrepancies in between codes and diagnosis, and then we said it doesn't sound like it's complete, it doesn't sound like maybe it's missing something, so we need more information. Then you have access to the patient's medical record. Now you can verify if the codes, if the diagnosis, the procedures, everything was done correctly. Because remember, this is a form that the medical doctor fills complete after they have evaluated the patient. They start filling this out because this had to be sent to the billing department. So that's basically what it is. So this is the front and this is the back. Now the encounter form has all these clauses and disclosures. Here, most likely, what it says most of the information that was written there has to be accurate to the best of knowledge of the person that completed that form, which is the medical doctor. It's not anyone else. It's not the nurse. It's not the medical assistant who's going to complete this. It's not no one. It's the medical doctor, the medical provider, or nurse practitioner, physician's assistant who completed, who evaluated the patient. No one else should complete this. So that's basically how it works. And here it says also that if any of this information is erroneous, something like that, the patient has to pay. If the insurance does not pay, regardless if it was a mistake from the doctor or not completing the form, the patient is going to be responsible for payment. And the medical doctors have to assume the consequences If the bill is rejected for any reason that they didn't completely correct it or something else, then they're not gonna get paid. So the whole form explains everything. So that's basically what it is. You can read it whenever you have some time, but I give you a summary of what all this information on the back of the encounter form entails. So that's basically what it is. So they want to make sure that the medical doctor knows that if something is wrong with this encounter form, then the insurance claim is going to be wrong because it's going to be completed using that information. And we cannot blame the insurance company for any errors. So that will be problems with the office, whoever completed that form, or whoever completes the codes during billing. So that's basically what it is. Okay, so we are going to continue with this processing of these insurance claims. Information from these documents is transferred to the CMS 1500. Remember, that's what I already told you. Information from that encounter form, chart slip, super bill. Don't forget those three names because that's going to come very handy for exams and when people talk in the office, so you know what they're talking about. Now they're going to be talking about all the time, but you're going to be encountering these conversations sometime during, your work performance. So what information are we getting? Again, remember the patient's information because we are going to bill on behalf of the patient. So all the patient's identification needs to be on that form as we saw on the example that I gave you. Codes and charges for procedures, services, codes for diagnosis, treatments, everything that was done, that was provided to the patient during that visit is going to be recorded right there in that encounter form, and that's going to be transcribed into these claim forms. So that's basically what it is. Once again, if the medical doctor makes an error when they are completing that encounter form, chart slip, or super bill, guess what? The form is not going to be correct. So we're going to have some problems. Probably the insurance is going to reject it. So that's basically what it is. So we continue with this. We have to make sure that when we're completing that form, we fill in all the information that is required on that particular form. We're going to see that form later on. I send it to you so you can open it up. And it's a digital form. It's an editable form. So if you want to do it, you can check. That's fine. That's not a problem. But for now, two things that you need to understand is more likely questions that are going to come from that form. That's basically what it is. So you already have the first one. What is the most common form used for billing the patients, particularly Medicaid and Medicare patients, or government patients, CMS 1500. There is no other form that the answer is going to be CMS 1500 regardless, unless they ask you, okay, what's the form that is used for inpatients? Oh, now it's different. That's going to be the UB40, but 04. So later on, we're going to just touch bases on that because usually medical assistants do not work in that part of the hospital where you have to complete that. This is mostly for doctors' offices because you encounter most of the things there in an office because it's small and you don't have the billing department and the patient comes to you directly. So that's basically what it is. So there is some information within this claim that you have to explain, you have to check some little boxes in those items, in those windows there, that is going to tell you if this condition is related to your employment or to an auto accident or motor vehicle accident or any other accident. Remember, because if that happens in a car accident, you cannot bill your insurance company. Then you have to bill the car insurance, whether your car, whether the person who caused the accident's insurance car. So the whole thing is very important. Now, also, we need to know if there was something that happens in the job, because if it was a related to the work performance that you do, that's going to be a workers' compensation form. So you cannot add it to the insurance. They're not going to pay. So these insurance claims are for conditions that you have, not something that you acquire due to an accident or due to a job-related injury. So you have to be very careful when you deal with this form. Because later on, when we talk about workers' compensation, we usually call it workers' comp, we're going to talk about that this is a work related. So we will discuss that when we get there. But this CMS 1500 is going to ask if this is a work related, car related, or motor vehicle accident related. Because if it is, and you check yes, this form is not the one that you have to complete, because we're not going to get paid. Someone else, some other insurance are going to be involved. So that's basically what it is. So be careful with all these questions, because it's not like I have insurance and then anything that happens, I'm going to use my insurance. No, doesn't work that way. Any questions about anything about the processing of insurance claim up to now? I don't want you to get this on the top of your head. I just explaining you how do we go about processing. First, we start with, where we're going to get all this information to complete one of these claims. That's basically what it is. And what information should be there in if something does not apply, we should not complete this form, because that needs to be done using a different or an additional insurance coverage, whether car insurance or workers' compensation insurance. Remember, that's how it works. Accepting accepting assignment. We talk about this. Now, when we accept assignment, this is for the medical providers, this is for the medical office, this is for the hospital. They are the one who determines whether we are going to accept what this insurance company is paying us for the services that we're going to provide for their patients, for the clients. Let's put it clients. Remember, accepting assignment is, okay, I'm a doctor, I have my office, I sign up with all these insurance companies, but each one, they're going to offer me a certain amount of money for certain procedures, evaluations. This insurance company not all offers the same rates, the same premium, the same copayment, the same coinsurance. They don't. Each one is independent. Think about you go to a store and you buy something. This item here might be cheaper than the item in the other store, but it's the same item. Each one puts their own price. It's not like everything is standardized. Oh, if I use Oxford, if I use United Healthcare, if I use Blue Cross Blue Shield, so all of them is going to pay the same to the medical doctor. No, we're going to contract with them. We're going to sign with them. We talk about that. Because remember, these are participating providers. If I'm a medical doctor, I own my office, I sign up with insurances that I think that they're going to pay me more for each visit, for each procedure. That's how I would do. So that's basically what it is. So accepting assignment is if I sign a contract with them, because I'm going to take their clients as my patients and I'm going to be paid by this plan, then I'm a participating provider or entity. So that's basically how it is. So if I accept that they're going to pay me for each regular visit, follow up, I'm going to pay you $200 for each of your patients. Each insurance company is different, but this insurance company is going to pay me this much. If I accept, that's what I have to wait. That's what I have to count on it. Think about your salary. I'm going to pay you $15 per hour. And you say, yes. Okay. So what are you going to be expecting? That you're going to get paid more at the end of the week or the month or by the day that you're going to get your paycheck? No, you're not going to get more. Plus, you're going to get tax deductions, right? So you're not going to receive those actually $15 per hour. You're going to receive less. That's the same as the insurance company. They say, I'm going to pay you $200 for each patient for a regular visit. If it is 30 minutes, I'm going to pay you $250. If it is 45 minutes, I'm going to pay you $300. And if it is for blood, I'm going to pay you $200 for each little bottle of blood. If it is an EKG, I'm going to pay you $100 for each EKG. So every single time that I have my patients and I order all these tests, I know how much I'm going to get paid because I already have a contract with them. Remember that we don't use insurance companies that we do not contract with them because then we are not participant. We're not participating providers. That's called non-participating providers. So then they're going to pay you differently because you're not. This is like having a membership from a company. You're going to get discount. But if you don't have a membership, you have to pay the price, right? The regular price. So that's basically how it is. Being a member, non-member. Participant is being a member, non-member is non-participant providers. So that's what I want you to understand. So I'm giving you certain examples that we are more commonly used to face in our daily life. So versus talking about insurance. Now it says right here, the medical doctor is going to say whatever you contracted, whatever you agree with the insurance company, you're going to get paid for your clients. That's what you're going to get. Now, if the insurance pay you this much, but the medical provider charged more for other reasons because the test was costly, but the insurance is not paying for it, then you have to talk to your patient and you have to tell your patient, okay, this procedure is not covered by your insurance, or your insurance do not pay the whole amount for this procedure. So you will be responsible for the balance. So then the patient is going to be responsible. Remember, anything that the insurance do not cover, patient is responsible for it. Always. That's how it's going to work. Now, it says right here, note, there is always this kind of confusion, so to speak, with people not understanding exactly what is the difference between accepting assignment and assignment of benefits. See, that is a totally different definition. Remember, accepting assignment is when the medical provider, this is the medical provider, that is accepting whatever agreements they have with the insurance for payments. Now, assignment of benefits, which means that the patient or insurer authorizes the payer to reimburse the provider directly. So let me tell you this. Or let me clarify you this. Assignment of benefits. There was a time that back in the days, I was in here, I never encountered that situation, but I heard about it. Because, when I went to school, they told me about it. Now, it's been years back, then the insurance reimbursed the patient for the services and the patient paid the provider. That was the way back in the days was done. Can you imagine what a mess? Now the patient receives the money. Now the patient thinks that that money belongs to them. And now it's very difficult to get this money back to the medical provider because the patient was the one who was receiving the services. I said, hey, I'm going to give you the money and you go pay your provider, okay? But that didn't work. Now we have assignment of benefits, which is, remember, now the doctor is going to receive the payments directly from the insurance, not the insurance pays the patient, and now the patient is going to pay the medical provider. That took that causes lots of problems. So the key here is do not mix up these accept assignments because these are common questions for exam. Okay, so don't twist them because then you're gonna be in trouble. So that's basically what it is. So accepting assignment is the provider. The provider accepts the money that the insurance company has offered for each of their clients. Assignment of benefits means that now the provider, so the patient says, well, yeah, pay directly the provider, not me. Well, it's not that the patient says that. That was not the idea. It was the insurance because it was causing too much problem. So now, if you want to see this doctor, we're not going to pay you, patient. We're going to pay directly the physician that provides the services for you. So that's basically what it is. So that is the difference between accepting assignment and assignment of benefits. And there are other terms that we are going to be discussing later on that I don't want you to mix them up either, because those terms are the ones that when you see them, you think that if you see accepting assignment, assignment of benefits and explanation of benefits or review of assignments. I said, oh my God, what is all this? All the assignments, which one is one? Because remember, that's what causes us to kind of crash right there when we see this question. So we need to understand them. So assignment of benefits, patient or insurer authorizes the payer to reimburse the provider directly. Remember, I already told you the story back in the days. The insurance paid the patient pays the provider, but that did not work well. So for that reason now, hey, patient, remember, you're gonna buy my insurance, but we're not gonna reimburse you for the services. We're gonna reimburse your provider. Take it or leave it. So that's how it works now. For those who never encountered this situation before or you didn't know, that's the way it was before. Accounts receivable. This is a question for exam. They're gonna ask you, what is accounts receivable? Now, they're not gonna ask you directly what is accounts receivable. So what I'm trying to tell you is, what is accounts receivable? Anything, any amount of money that is owed to the office, to your hospital, any money that we receive, any money that somebody owes us, that belongs to the accounts receivable, because receivable is money that we're going to receive. It's not the patient, it's the office for services. So any money for all these claims that we send out to the insurance company, those are accounts receivables, because this is money that we are going to receive. The copayment, that's accounts receivable. That goes to the accounts receivables. The deductible, the co-insurance, all these accounts receivables. So the key is that any money that is owed to the office, to the hospital, that's account receivable. The opposite always is true. Accounts payable. Anything that we pay, any money that goes out, your salary is accounts payable. Why? Because it's money that I'm taking from my account and I'm giving it to you. It's leaving my office, not coming in. So that's how you have to see it. But you're not going to be asked about accounts payable. You're going to be asking about accounts receivable. So think about that. Any money. The patient pays $20 for the copayment. To which account this money is going to go? Receivable. So again, this is very, very important that you understand. These are very kind of, easy because the word said all. Accounts receivable. Somebody's paying you. They owe you that money. So for that reason, it's going to be accounts receivable for any reason. So that's how it works. So how do we get these accomplished, these accounts receivables? Very important because I told you already like 10 times, and this is the number 11 probably. Insurance verification and eligibility. Remember, every single time your patient walks in your office because he has an appointment, the first thing that you have to do after you greet your patient and you verify what patient it is, may I have your insurance card, please? It's not that you're just going to see the insurance card. No, you are going to verify that this patient has coverage for that particular day. Because if the patient doesn't have coverage for the particular day, we are not going to get paid, period. So that is what it says, insurance verification for eligibility, to see whether you have coverage or not. This is not an option. If you don't do it, you are going to have tough time trying to explain why didn't you verify on that particular day the patient insurance, because now we have any problems. The insurance company do not want to pay because the day that the patient has his or her visit, patient was not eligible, did not have coverage. So this is one of the reasons the insurance can deny your claim. Remember, who wants to pay? No one. But if I find something that you did wrong, I'm going to take it as my, I take it as an advantage to my company. And now I don't have to pay you for those services. Why? Because you didn't follow the instructions, you didn't follow the regulations. So we have to explain, remember, our patients, family, every single time that a patient register, remember, you sign in this paragraph. There's tiny type paragraph on the bottom of the page of the registration form. Read it to them. Remember, I've been saying this all the time. Read it to them, explain them what exactly is written there before they sign. Because you are going to encounter this oh, I didn't know. Nobody told me. Oh, but you signed the paper. That's not an excuse. Yes, you're responsible to pay. But you didn't give me the chance. You didn't tell them to read that information. Tell them to read the information. Did you understand that? Okay, let me go over it with you. Remember, at the bottom of that page states that you, as the patient, are obliged to pay any balances the insurance do not cover. If the insurance does not cover this, you're going to be responsible. If the insurance pays part of it, you're going to be responsible for the balance. You're responsible for the copayment, the money that you have to pay every single visit. It is written right there on your ID card. That's what you ask the card, because then you're going to learn. You're not going to ask the patient, oh, you have a copayment? Do you know how much you pay? No, you don't have to ask that. You go and read the insurance card. It says, oh, regular visit, doctor's office, $15, $20, $25. Okay. So we have a copayment today. You're going to pay now? Check, credit card, money order, cash. That's how you do it. I never did this in my job because that's not what I do, but I know it. I've seen it. I learned it. So you have to be upfront. Don't be shy. Don't be afraid. No, because this can cost your job if you don't tell them what is it. And one more thing that is written right there on that paragraph at the end of that registration form is, okay, your information will be disclosed to all the entities, that are our associates. So just in case, if we need information to be released outside of the people that is treating you, then we will request your permission, your release of information. So that's how it's done, because if you don't do it that way, now things are going really, really, really bad. The patient is not going to pay for the services, and they're going to bill the patient. And eventually, patient account is going to go collections. And the patient is going to be furious, particularly with you, because you never explained them, or, whatever else happens. But we're not going to get paid. Pre-authorization or pre-certification, I mentioned this before. Remember, for these HMOs or these governmental insurances, you have a medical provider, a PCP, who is your gatekeeper, remember? So therefore, you're going to be needing referrals. So when you talk about pre-authorization or pre-certification, that means this patient have an insurance that has some limitations. And before we order something, then it has to be pre-approved, pre-authorized, pre-certified. So you can't just order services. Yes, you can order services, but you have to ask for pre-certification first or pre-authorization. So that's a question for your exam. A patient has, always going to tell you that the patient has an HMO and the patient needs a pre-authorization. So if a patient has an HMO, immediately you need, what does the patient needs to get approved for the particular procedure? Pre-authorization, pre-certification. If you're a medical assistant working in a doctor's office, chances are you're going to be working in the front and you're going to encounter this situation. So for that reason, it's very important that you know it. And if you are lucky enough and you don't end up in the front desk, well, you'll encounter these questions on your exam. So for that reason, either or, you get the information. Now, every single time that we get paid, every single time that we register the patient, every single time the doctor sees, evaluates, orders something the patient, we need to document everything all the time. It has to be done. Remember, if you did not document it, means it wasn't done. It didn't happen. That is how it works. So keep it in mind all the time. Remember, you have something in, you create a pass, login for one of your emails. You didn't document it. You didn't write it down somewhere. Then you forgot about it. You didn't set it up, your emails automatically. So that I have to be enter your passcode every single time. So if you don't use it, you're gonna lose it. Next time you're gonna try to say, oh, what was the code? What was it? Oh, I don't recall. Now I cannot use that email. That's exactly what happened here. If you did not document that information, where are you gonna get it from? And you have to do it right away when the information is fresh in your brain. Otherwise, that information is not there. The medical records or the chart slip is not completed. Billing cannot move ahead. They cannot bill for the patient. And remember, we have some time, some deadlines for submitting these claims. And if we don't meet that criteria, then we're going to lose the whole thing. We're not going to get paid. So that's basically what it is. Every single transaction, let's put it that way, because we're talking about billing. Every single transaction needs to be documented. And we have to have a copy in the patient's medical records. So we know what's being done, what's being paid, what's going on with that account. Because remember, talking about accounts receivable, and we have accounts payable. But accounts receivable is the most important part in our office. Well, both of them are important. But how are we going to pay when we have not received the money for the services provided? How are we going to pay you? How are we going to pay rent? How are we going to pay for the utilities? And whatever else is needed in the office. So money is crucial for business. Billing and claims submission, remember these are part of accounts receivable because these are claims that have been submitted for collection, not for collection, for payments. So that's basically what it is. And if you see across this chapter, we're going to talk about the CMS 1500, CMS 1500, CMS, because it's the most common. So if I do not mention a form here, if you see something else in your exams, if I never mention it, don't assume that that is something that I forgot to tell you. No, it's just done. If I didn't mention it, it's not there. Do not pick those as answers. Pick those as the no answer. All of the following are part of, submitting a claim or completing the CMS 15, except or is not part. So read the questions because you know the answer. I know that you know the answer. But if you don't read the question, you do not get the right answer. In my exams, you see, you're not going to have it in your exam, in the computer exam, national. You're not going to have someone underline what it says is not, except. You're not going to have some because I'm giving you a hint right there. This is what you have to look for. So don't think that the underline or underlining part that I put there is as part of decoration or to make the word looks nicer. No, that's not my purpose. It's for you to focus exactly on that particular part because that particular part is the one that gives you the answer. I'm always been telling you, read the question. If you do not understand the question, I'm telling you, it's going to be 90% chances that the answer is going to be wrong. Because we start from there, reading the question. So remember that I always trying to kind of, bring up all these test taking, tips because that's how it works. If I remind you all the time, it's going to come to your brain when you see these particular situations. So that's basically how it is. So we're going to submit those claims. Remember, it's completed. We use the encounter form or the charge slip or the super bill. We get the information from there, complete the form, and then we submit the form. That's basically how it is. And now we're going to wait for the insurance to be processed by the insurance company. This claim is going to be processed by them. And then you're going to receive a notice. And if we have this software application as we do nowadays, you're going to keep track. You can go on the system and see which account from each patient, what is the status? What is it right now? It's in process. It's been approved. It's been paid. It's been rejected. So all those things we're going to keep it in mind. Now, when we submit an account, remember, we are going to follow up. Isn't it that you follow up whenever, you submit some application for something? What is the purpose of submitting an application? Because you need some results, you need some answers. Here, we need some payments, so we need to know what is the payment at. What is it? How far is the insurance company, gone with the processing of my application, my payment? We need the money. Remember, these are account receivables that we still pending. So that's how it works. So make sure that you do understand this. We're not gonna add little things here and there. It's just how this works. Just the simple thing, the basic things that we are going to talk about for these claims. Remember, simple. Completing the CMS 1500 claim. So this is kind of overlapping again. We're going to get all the information from the encounter form, remember, and we're going to start filling in the application. All these little, boxes that are there that needs to be completed, and they are numbered. We're going to go over those just in a glance, so for you to understand. So that's basically what it is. And it has to be double checked. This is like when you write an essay. Before you present it to someone, to your teacher, you have to proofread this or ask someone to do it for you. Because we're going to make sure that all those, items are complete and they are correct. Sometimes it can be interchanged because, maybe you were going too fast. Maybe you were thinking about something else and then you misplace kind of thing items. Then, instead of placing the patient's first name, you place the patient last name instead. And then you put the patient's first name, what is the last name, so on and so forth. So adding things that you're not supposed to, certain punctuations are not allowed, certain things are allowed. So when you don't follow exactly what it is, then you're not going to be able to complete the claim. Some of the claims, fortunately, do not allow you to move to the next item until you fix the prior one, because it's telling you that something is wrong. This is like when you enter your passcode and it's not the correct one. You're not going to be able to access whatever account you have. Some forms are tailored, customized like that. After finishing all this, the medical doctor has to sign this forms. But, we have something that is called signature on file. So can you imagine looking for the doctor every single time that and if there are like 200, 300,000 of claim forms needs to be submitted to the insurance company. Can you imagine a doctor signing all of those? I don't think so. So we have the doctor's signature on file. This is almost 100% of the check of the time. Sometimes you don't, if you are having a small practice, a single doctor, maybe the single doctor wants to go there and check it out before they sign it. They want to make sure that everything is good because most of the medical doctors, they're kind of familiarized because they're in their own business. They need to learn. So that's basically what it is. If you need to submit any supporting information, just to prove that this test, this procedure was needed, it was a necessity, and you know already that this insurance company is going to require and is going to delay the process later on, submit it alongside with the claim. So that's basically what it is. Think about you completing some forms for any type of application. Oh, you're completing your registration to enter school, college, university. Supporting information. What is the supporting information for college? Oh, do you have a high school diploma? It's not just yes or no. Add it to it, attach it. Any forms of ID that they might require from you, or any other document for that matter. So before you send it, add all this information because that's gonna delay the process. These claims are going to be delayed because you did not provide enough information, because sending just the diagnosis, the procedure by itself doesn't explain anything. But there are some procedures that you need some supporting documents. That's when we attach a copy of the progress notes from the page. Now, this is with the authorization of the doctor, of course, but we're going to get paid. But the billing department is the one in charge of doing all that. If you don't attach your high school diploma or any other documents that are required for the processing of your application, in this case, for the processing of this claim, then the insurance is going to read it. It's going to notice that if something is missing, and it's going to take time, and it's going to say, hey, can you send me this document? And then, hey, can you send me this other document? So how long it's going to take between, all these back and forth situation? So now we send it alongside, so everything is there. So they don't have to be bothering us. They're just going to send us the money. That's it. That's what we want. So we don't want to be playing ball right here. So that's how it works, completing the CMS 1500. So questions for the exam. Pay attention here, because this is not difficult. This is kind of memorization. These are one of the things that you need to memorize. Which parts of the CMS 1500 of the insurance claim belongs to the patient? Boxes or blocks 1 to 13. That's it. Which boxes or blocks in the insurance claim belongs to the medical provider? 14 to 33. So in total, in these forms, there are 33 blocks. We usually call it blocks. It's like a little, the little windows, the little boxes when you enter the information. That is what we're talking about. So let me show you the form because I have it right here. So let me show it to you. I sent it to you already. So make sure that, you check it out. So this is the form. So can you guys see it? Okay, so here it is, the first part, 1, 2, 3. I've talked about all the insurances, and everything is related to the patient. Why? Because it's 1 to 13, everything related to the patient. All the information is about the patient. From 13 and up, that's gonna be the medical provider that is gonna enter that information. So that's basically what. So this is the form. See, it has all the information, the windows right here, and the instructions on the second page. So that's basically what it is. So for the purpose of the exam, your exam, just remember windows or blocks. The first 13 blocks, 1 to 13, is going to be patient's information, the patient's data. And 14 to 33, because the form has 33 items, everything from 14 to 33, that's it. So you don't even have to remember 14 to 33. No, 1 to 13. You know that there are 33 blocks right here when information needs to be entered. So the first 13, patient, and everything else is the providers that has to enter that information. Now, don't take it literally. It's not that the medical doctor is going to be entering that information. No, that is the information related to what the doctors did during the encounter with the patient. The encounter form is going to be completed by the doctor, not this form. This is done by the biller person in the billing coding department. So that's how it works. So the first 13 blocks are going to be everything related to the patient. 14 to 33 is everything the doctor collected from the patient. So it is from the side of the doctor. That's when you're going to have the type of service, the time that the patient, that medical doctor spend with the patient, because we're not charged for that. What procedures were done? What is the diagnosis? Primary diagnosis, the first diagnosis, the primary diagnosis is the diagnosis that the patient received on that particular day of the visit. If a patient already have diabetes, the primary diagnosis is not going to be diabetes. The patient already have that. I already billed the patient for diabetes long time ago. Now, what is the patient here for? For whatever other reason the patient was there. I have a headache. So then it was a headache. I have a back pain. Then it was a back pain. And if it is related to diabetes, then I'm not going to put diabetes. I'm going to put something that it was related. Oh, hyperglycemia. The patient glucose went sky high. But I'm not going to say diabetes. No, the patient already have diabetes. Now it has an episode when the patient's glucose just went to the roof. And that's the reason that my patient is here. Or it dropped down the glucose. Or patient has already conditions with cholesterol. Now we're going to explain the reason that the patient is here, not that the patient already have high levels of cholesterol, because we already have that diagnosis. So that will be the primary diagnosis. But you're not going to be asked about that. Just to tell you what is it that is documented on windows or blocks 14 to 33. There is going to be the ID from the medical doctor, the ID from the hospital where the medical doctor works at. So it's going to be all the names of the procedures and the times, diagnosis, that's it. And then the patient, the medical doctor signs. And most of the time, remember, the signature of the doctor is on file. Because the billing department might be somewhere else away from the doctor's office, the doctor's not going to go there and sign. So we keep the signature on file. Any questions about the blocks that makes up this insurance claim form? Remember, there are 33 blocks. The first 13 are for the information of the patient. 14 to 33 is all information about what the doctor did during that particular encounter. Got it? Good. Let's go back then to the chapter. Continue. So here it is. So once again, if any doubts, remember you have your slides. You can go back there and check it out. But just keep it in mind and review it later on, because remember, you are not going to be taking this exam anytime soon. So if you're not taking the exam anytime soon, you might, you might forget this. So then later on, you're going to review your material. So you're going to make sure that you have all these. So here it says, see patient data. Patient data is the patient demographics, everything about the patient, everything, including insurance, whether it works, it doesn't work, whether, because remember, if the patient works, then does the patient have insurance, or the patient is dependent, or the patient has primary and secondary insurance, whether the condition was related to, remember, it is just a condition that the patient has, or it was related to your workplace, an injury, or outside, an accident with someone else. So all those things needs to be documented. So that's how it works. Now blocks 14 to 33 says right there, provider's information. Now is the provider's information that was collected by the provider. Information and services provided to the patient, reasons for the services. So again, very important. Here there is a link also for this CMS 1500, an electronic editable format as well. So you can check it out. It's just that I found something else. Okay, so moving on, managing new patients. So remember, what is a new patient? You need to know what is a new patient. It sounds so simple. You might think, oh, professor, I know what is a new patient. But sometimes we have a little twist with new patients. I mentioned this before when we talk about medical records. But hey, we tend to forget things because we are not used to, right? So when we have new patients, remember, for the first time, we have scheduled an appointment with this patient. So for sure, we're going to get paid a little bit more because the first time we're going to do a complete physical exam. I'm going to order certain things that in regular basis we don't, because we need to keep some basic information about the patient. We don't know anything about the patient. We just start getting to know our patient for the first time. So we're going to ask them to complete all these forms as we discussed it in medical record. So now we're going to charge for the visit, for the procedures. So that is basically how it is. This is a new patient, remember. It's someone who, for the first time, we are having in our office. That is one definition. The second definition, remember, is the one that we tend to forget. If a patient has not been seen in our office for more than 3 years, this patient is considered a new patient. If you remember, those who took electronic medical records or medical records, we talk about established and new patients. We talk about this purging of files, medical records, which are considered active, inactive, and closed, right? I remember that. So what is a closed medical record? A closed medical record is a medical data or medical record from a patient that has not come to our office for the past 3 years. I have not seen you. Last time that I saw you was 3 years ago. But prior to that, we removed this to the inactive. After 1 year, over 1 year, you did not show up, inactive. I'm going to place it aside. 3 years went by, close. We're not going to use this medical record anymore. The inactive, we can pull them back and put it as an active if the patient returns within that period of time, which is maybe 1 year, 1.5 years. All depends on your office. But if it just lapsed more than 3 years that I have not seen you from the last visit that I check on your medical records, then you no longer consider our patient. You will be a new patient if you return after 3 years. See, that's something that you need to keep in mind because these are questions for exam. So remember, you're not going to be looking for a chart from a patient who has not shown up to our office for more than 3 years. Probably you're not going to find it. And if you find it in a doctor's office, then do not pass this medical record to the medical doctor. Try to open up, create a new one. Because the medical doctor is not going to take it. If it is paper, they're not going to take it. You have to bring a new chart, new registration form, signature again, explanations again. Give me all your information about your family history, your past medical history, social history, everything about you. I need everything in copies of your insurance card, front and back. Put on the file. That's how it works. So these are new patients. So when you have a new patient, remember, you got to make sure that you collect all the information from this patient. So don't assume that the patient has been there before. Always ask. Always ask. Because you don't know all the patients. You haven't seen these patients because you're going to be new in this office. So whenever you see a patient, say, oh, I want to make an appointment. Sure, not a problem. Have you been here before? Yes. Okay. May I have your insurance card, please? And they gave it to you. Oh, you're the first one who asked me for it. Nobody asked me for it. Well, you're doing a good job. So don't listen to that. That's it. You take the, and you verify the insurance eligibility for that day. If it is a new patient, now you're going to know that the patient has not been there. Now make sure that you know that that insurance that the patient has, because you're going to ask the patient, oh, you new patient? Sure, not a problem. May I have your insurance, please? They have your insurance card. And if you don't know, you ask someone else. I have a new patient. She or he has this insurance. Do we take this insurance? Remember, do not assume that every single insurance is taken by your doctor's office. No. In a hospital, you don't have to be worried. You don't have to be doing that. Not at all. You don't do any administrative work. Unless you apply to work in the billing department, that's a different issue. But as a medical assistant, you will not be doing any administrative work. So for that reason, you're not worried in a doctor's offices where you should be working. Because remember, if you register a patient whose insurance this office do not participate with, then you're gonna be wasting the time with this patient, and this patient is gonna be furious But you're gonna put them to why, and then you're gonna tell them, because they're gonna see the doctor, and the doctor says, "Oh, I'm sorry, but I'm not gonna be able to see you. Why? Because we do not take your insurance. Why didn't tell me in the front?" Yeah, we have a problem now. So again, when you don't know something, ask. This is what's going on in the real world with these new patients. Make sure that you gather all the information that you need. And you have to explain them all the time. What is the registration form all about? Remember, when it comes to money, nobody wants to know about paying. People assume that because I have insurance, the insurance has to pay everything. Not every single insurance works that way. Particularly if you have a group insurance from your employer, you might have to pay copay. You might have to pay co-insurance. You have to pay part of the premium. But every single time that you go to the office, you have to reimburse the office for something. So you have to make sure that you explain this to your patients. If you don't, you're going to be in trouble. So again, here it is. It says right there, determine whether appropriate office has been contacted, participating provider. You are verifying that the patient's insurance works, that the patient is eligible to receive services on that particular day. So again, patient fills we talk about this, the patient is going to complete this patient registration form and all the information that is needed. If the patient doesn't understand, the patient is taking too long completing this form, you got to offer assistance to the patient. Do not tell the patient, let me help you out because you're taking too long. That is not appropriate. Mr. and Ms. Smith, if you need my assistance, if you have any issues with the form, how to complete your form, please, I'm here to help. Or let me know. I will assist you. Particularly for those patients who have barriers to communication, language, barriers. So you have to be on top of that. It says right here, because this is a question for your test, make a photocopy front and back of the patient's insurance card. Always during registration, this is for new patients. And every single time the patient changes insurance. Remember, we changed insurance, just like we change cellular numbers, change emails. Now, these copies are going to go to the medical records with the financial part is. There's a section for financial. That's when you're going to place these photocopies. If it is paper, if it is digital, then you're going to add it to it. So that is how it works. So remember, for new patients, we are going to make photocopy of the patient's insurance card front and back. And that's when we're going to find out, we're going to verify, the front. Why the front? Because the front sets the name of the insurance, what coverage the patient have, what copayments the patient have. What about the back? Because the back is where you have the phone number when you are going to contact, and the website that you can contact the insurance company, whether the patient or whether the medical providers. Oh, excuse me, Mr. and Ms. Smith, you do not have coverage for today visit. Oh, what do you mean? No, my insurance, I have insurance for the whole year. Well, see here, I have this little receipt that the machine gave me, or the information. So you have to call. Where do I call? I don't know, never called. This is the first time that not a problem. If you look on the back of your insurance, there is an 800 number. This is a toll-free number that you can call and check. You can use our line from here if you want, because this is your client. You don't want to let them go. But if you don't know, what are you going to get? You're going to try to go online and try to spend 3 hours looking for the number for the insurance to find a contact information. No, it is right there on the back of the insurance card. That is the purpose of making copies. You have to be familiar with this. You're going to encounter this situation. I know most of this information, not just because I went to the school to learn, because I learned most of the stuff, but I learned in my friend's doctor's office. They were doing all of this, and I was like, hearing all those things, paying attention to all those things, because my office was right close to the front desk. So I heard all these things, and then I was like, oh, wait a minute, this is interesting. And it came very handy because now I know it. That's what you're going to do very well in your exam, because you have most of the stuff that I'm telling you that is going to be here. So know this, you're going to be fine. Okay, remember these copies, you're going to add it to the patient's medical record. Making copies and not adding it to the medical records, what is the purpose? Because we need to have these copies of the medical records. You cannot keep the patient's original card with you. It has to be returned back to the patient. So any IDs that you request from the patient to verify that this is the right patient, that the patient's insurance actually belongs to this patient, because sometimes certain insurances do not have a ID or photo ID, then you request for a photo ID. Driver license or a ID, issued by the state, it is good as well. But learn those things. See, here I have one of the pictures from one of the insurance cards or patient's identification card. So this is the United Healthcare. Now, it can be Oxford, it can be Blue Cross Blue Shield, it can be Cigna. Oh, still remember some of the insurances. It can be Blue Cross Blue Shield, it can be anything. It doesn't matter. But the purpose is for you to understand that when we do the copies, we do front, which is this part, and we have the back, which is this part of the card. And here we have the name of the insurer or the payer, remember? And it's right here, it says the name of the insurer, the ID member, because we need to verify all that to make sure that we have the right patient. If the patient works for a company, it says a group number. So that's basically what it is. Just looking at the card, we know already if this patient, what type of insurance the patient has. Whether it's group, whether it's self-pay, or it is government insurance. Patient comes with a Medicare, government. Patient comes with Medicaid, or any of those other insurances under the umbrella of Medicaid, like Fidelis, Health Plus, Metro Plus, and others. I don't even remember anymore of those insurances. Then you know that this is government. The military insurances, you're not going to encounter this because military personnel usually have certain assigned hospitals for them. So most of the time, you're not going to encounter this. So that's exactly how it is. And if you look right here, it's going to tell you copay, office visit, $10, ER, $50, specialist, $15. ER is the most costly of all services. ER usually charge you the highest copay. But once again, that's when you're going to find out most of the information. So you don't have to be asking the patient. Because I hear some people in the front desk, oh, Mr. Mrs. Smith, do you have any copay? What are you asking the patient? That's something that you should know. Because you're going to be receiving the card. And the card said, if the card doesn't say anything, then the patient don't have a copay. If the patient has government insurance, usually you do not have a copay. Other than that, this insurance card. So for that purpose, I also want to see the patient's insurance card because I'm not going to know by heart how much is the copay for each of these insurance card. I don't know. I'm not that smart. I don't have enough, space on my brain to remember all that. No, that's what we have information there. That's what we have a medical records there. Because we're not going to remember everything that, collect from the patient. But we have records, so we can go there and use them as a reference. So that's the reason that I just placed this one right here. Okay, so that's something that's simple. This is for private insurances. Now, be careful because I said private, but United Healthcare also participates as a HMO. Now, that's a different issue. Don't go by that. Because government means Medicaid, Medicare, TRICARE. That's it. Everything else is just different contracts that, these private, because United Healthcare is a private company. Blue Cross Blue Shield is a private company. Oxford is a private company. Cigna is a private company, and many other insurances. They just negotiate with the government. That is it, but they are not governmental. If you take this as a private insurance, it's going to be different from the ones that joins the HMOs. That's basically what it is. Medicare. So think about these Medicare insurance cards, because here they're going to tell you exactly what services the person who owns this card is allowed to. So here we have, so Medicare, if you're not familiar with these cards, usually these are kind of paper cards, but they are laminated and they have three colors, see? Red, white, and blue. It looks like a little flag on top. And it says there, Medicare, right here. Now here has the name of the person who has Medicare, who is insured, or the policy holder. Here it has an ID. Now, this ID usually ends with the letter. That letter thing applies for the type of benefits that the patient has. So if you have a Medicare and it ends in A, that means that this is part A that you cover. See, hospitals. So if you have part 8, we will discuss that when we get to Medicare. The 8 or the letter at the end of this number, remember what I'm saying? Because if you have a question on your exam and you don't know what letter means at the end of your ID from your Medicare, then you're going to get the wrong answer. So the letter means the plan, the benefits that you are qualified for. This is for Medicare, remember. So most of the time is your social security number plus a letter at the end. So that's how we know someone who has a Medicare because they work for more than 10 years. So they retire, or they did not retire, but you get, after 65, you qualify to get Medicare. So part A, the letter A, it can be B, it can be C, it can be other letters. So each one of them determines what plan, what benefits you are entitled with this insurance. So that's how we know whether you are a dependent, whether you are disabled, and that's the reason that you got this card, because it has another letter at the end of this ID number. Part B covers all the services in an outpatient setting. Remember, hospital means hospitalized. You have been admitted. Then it's part A. Part B is for your regular visits in your outpatient doctors, visits, procedures, that is, ambulatory services. Just for you to have an idea when you see these cards and you know what is this about. So very interesting. Okay, we will discuss these parts of benefit plans for Medicare when we get Medicare, because we're going to talk about Medicaid, Medicare, and workers' compensation, because these are very, very common insurances that you're going to be receiving in your workplace, and because these are very common questions that they are come in exam. So I want to make sure that I try to give you as much as possible so you can do really well with this. Okay, so managing new patients, we discussed this already. We not contact the payer. Remember, this is repetition, one way and another. They have different, ways of, trying to remind you what is it that we have to do whenever we have a new patient. Remember, Vina confirms the patient's insurance. Remember, we're going to make sure that we know that these patients are, is gonna, the insurance that this patient has is accepted in our office. And if it is accepted, we have to verify that the patient is currently active with insurance, that we're going to get paid, that we're not going to have problems then collecting the money from the patient, because the insurance is not going to pay. So right here, collect the payment. That's basically what it is. So if it's not, we don't waste time with the patient. We're going to tell the patient, I'm sorry, Mr. and Mrs. Smith, we do not participate with this insurance. So we don't take this insurance. Explain them. Be nice. That's it. So this patient might think that it is you being biased or you discriminating them for some reason. No, you explain them. That's the reason why you ask for the insurance card, to make sure we're talking about new patients. And we check for patients who are established patients all the time. That doesn't change. But here is to enroll the client, that we are sure that we take that insurance. So basically, that's how it works. Primary versus secondary insurance. So what is primary insurance? It is the plan that is responsible for the payment of the claim that is used first. So that's basically what it is. So if you have a primary insurance, means that this insurance is going to cover most of the payment, most of the services that you receive from your provider. That's basically what it is. Now, after payment by the primary insurance or insurer, because it's the person, the insurance company, then the secondary is bill. So that's how it works. Now, think about this. We do not bill the insurance using both insurances at the same time. We don't. Oh, we're going to insure this. No, because there are different insurance companies. If it is the same one, then we send one bill. See, think about this. You might have two different insurances. You have your own insurance and you have your husband's or your wife's insurance. or you have your employment, and then you have one that you purchase on your own because you don't want to pay all the pocket. So you want to have an insurance because usually we save more money. You got your second insurance. So if it is two different insurance companies, you build the primary first, and when you receive the payment, we know what is the balance. Now we are going to send the new bill to the secondary. We cannot send it at the same time because we don't know how much the primary is going to reimburse us. Now, if it is the same company that we have the primary and the secondary, well, it's the same company, so we're going to send it to them. And they're going to maneuver there with the insurance. So that's basically what it is. So the primary is the one that is going to pay the highest amount of money. And the secondary is going to cover for the balance. And if you don't have a secondary, you're going to pay from your pocket the balance. Okay. So let's talk about primary. Let's gonna talk about children. How the children are covered with insurances, because this is another question for exam. So remember, I highlighted right there. So pay attention, keep it in mind, because if you don't, then you're gonna forget. Now we have to look at different situations. If a child is living with both parents, if both of the parents have insurance, then we apply the birthday rule. Now, this is where, the exam question comes about. They're going to ask you, what is the birthday rule? So remember the birthday rule because it's the birthday. Think about, first of all, a newborn. Think about a child. Second of all, the person who holds, or the policy holder, the person who has the insurance, who meets the following criteria: their birthday, month, and day occurs first in the calendar year, that's the primary policy that is going to pay. That's basically what it is. Not difficult. So think about this. The parents are not separated because we're going to have other one. What if the parents are divorced? Who's going to be the primary? Oh, we will discuss that later. But for now, think about the child lives with the parents. Now, both of them have insurance, because if only one of them have insurance, that's the primary. But here there are two insurances. Father, mother have the insurance. So who else is gonna pay? So you're gonna say, well, we're gonna put it to the one that makes more money, right? No, it doesn't work that way. That's what I thought. When my child was born, I said, I have insurance. My ex did have insurance. She was making more money than me because at that time she has higher profession. I was a medical doctor at the time. So I was like, well, because you're making more money, let's put you in the insurance because, they're going to get the money from the money that you're paying over there because you made more money. It doesn't work that way. It goes for the person, the parent, which birthday is first, month, and date. So let's say, I'm not saying my birthday, but I'll just give you an example. Let's say that I was born on January the 1st. So then that's basically what it is. And my ex, it was born in December 11th. So who is going to be the primary? Hers. Oh, mine, I'm sorry, because it's the first of the month. I was in June the 1st. She is December the 12th or the 11th. So I am the one whose birthday runs first in the year calendar. So for that reason, remember it's month, and year. So then the birthday role goes to me. It's not that I am I am the custodian of the child, or I am, the one who's going to be responsible. No, I'm responsible only for the insurance. That's it. So that's the birthday rule, remember. So applies for children and applies for, the person whose insurance falls first month and day of that particular calendar uh, of the year. So that's how it is. It's not difficult. So anything else we're gonna talk about later on, because there are more. If you are divorced, if you do something, so we're gonna go on break and then we continue with this information. Okay. So let me see, because I know it's more than 7. Okay, so we're gonna come back at 7:40 and we're gonna continue with this. All right. Any questions before we go on break? 7:40, remember, it's always going to be post. So if for any reason you step out a little bit away from the screen or something else, you go to the bathroom, to the kitchen, you answering the phone, whatever it is, because hey, we have lives, and you come back and you don't see me, don't get scared, don't think that I abandoned you. No, just we are on break. It says there, we're on break, we return at this time. All right. So just make sure that you return at a particular time. All right, so see you later at 7:40. Enjoy your break.
Thank you.
You are welcome.
Thank you. See you.
You're welcome. See you later. Okay, so we are back. Wow, time went so fast. Okay, let's go back to where we left off. Okay, so we were talking about the birthday rule, remember? So one of the things that you have to keep in mind is when it comes to insurance for children from parents that they're, you know, together and they have insurance, both of them, which insurance will be considered primary? That's what the question is all about. Then we use the birthday rule to determine that. So the parent whose birthday falls once again first month and day on that particular year, that's basically what it is. Okay, it's not the year. It's not like I'm older than you, I'm younger than you. No, it's the month and the day. That's it. That's the primary. And then what will be the other part in its insurance? That will be the secondary. Now, what about this is not asked, but this is for you to know. How do we determine which one is primary or secondary insurance based on gender? Oh, does the male has to pay or the female has to pay? That doesn't apply either, but most of the insurances based on background history from back in the days when most of the time the male was the one who was working, the one who bring the income to the home. The female was like stay on home, things like that. So based on that, they still keep it. Most of the states, by the way, the father will be the responsible for that insurance based on gender. Remember, so males usually are the ones. So the father will be responsible for the payments of the primary insurance. So that's basically what it is. But the birthday rule is the one that comes on exams. Now, what happens if the child is from divorced parents? So now think about this. Whoever it wins the custody of the child, that will be the primary policy holder for that child. Remember, a couple divorce who got the custody of the child, they are the responsible for that insurance of that child. So that person insurance will be the primary insurance. So then we forget all about the birthday rule. We forget all about the gender rule because according to the law, that's how it works because that's a court decision, remember. That's basically what it is. Unless the court determines otherwise. So because that have happened, that the female divorce the husband and then the female does not work, then it has to be supported by the husband. So the husband pays for that. But we're not talking about that. We're talking about these different policy rules according to who pays, whose insurance, whose parent insurance are the one who's going to be covering for the child. If they are divorced, remember the one who wins the custody, that's the one who's going to pay. Now, if custodial step parents policy, that will be secondary, the custodial step parent. Remember, if you have a step parent, now that policy will not be the primary. That will always be secondary. And if you are none of the above, then it will be tertiary. So that will be the third party to pay. Because remember, we can pay with a third insurance. It's just that not many people has three insurances. Most of the people have up to two. Because the husband has insurance, the wife has insurance. But if you have three insurances, Then in this case, non-custodial parent, then that would be tertiary. But no worry about that. Worry that only for the questions for the exam. And the most important thing, once again, if the parents still together, the birthday rule, if it is based on gender, usually the father is the one responsible for the primary insurance. And if the parents are divorced, then the parent that has the custody of the child, that wins the custody of the child, that will be responsible for the primary insurance. That's it. Any questions? I don't want you to be confused with this. Nothing to be confused about it, but there are so many things that we have discussed already. Okay. Now, create a new medical record for the patient. Remember, if we have a new patient, we have to create a new medical record. That is definitely the way it goes. Now we're going to generate again the patient encounter form. Remember, that is also known as super bill or chart slip to complete the claim, the insurance claim. Established patients now. So we talk about the new patients. Now we're going to go to establish. Usually we don't say all patients because that doesn't work. Oh, we have new patients and old patients. No, that's not how it works, because all patient might be misinterpreted as all of age, not in our office receiving services. So it's called new patient, established patient. That's it. So or it is new or established, nothing else. Remember, we're talking about patients. We're not talking about the medical records. So for those patients, we just going to follow the protocols of, of routine, which is, verifying the patient. We're going to make the appointment for the patient on the day that the patient is, available to come to the office. Then we're going to verify that all the information that the patient has submitted on the registration, on the day of the registration that was like 100 years ago, might be, who knows. We're going to make sure that all the information has not changed. We're going to keep information updated. Every single time a patient comes to our office, we must verify patient's eligibility or coverage for that particular day. It has to. We get accustomed, we get the bad habits that, oh, I have seen this patient. This patient was like a week ago. Oh, the patient was like not even 2 days ago. Here is again. What should I review? Because the insurance, the medical insurance can change, eligibility can change, can be canceled, can be suspended, or you run out of services. Some of the insurance give you a limitation for services. You already met the amount of services for this particular period of time, so you're not eligible to receive more services. So you have to wait more time, 6 months. Oh, during the 6 months, you have 20 regular visits that you're entitled to, but you already used all of them. So they cancel your eligibility, not that they cancel your insurance. Meaning you have the maximum of visits already, or you already have the EKG or the mammogram for that particular year or anything else. So you're not allowed to use it anymore. Unless it's a necessity now, we have to send requests for pre-approval, pre-certification. So again, we can dismiss this because this is the major issue that we have encountered with billing being, with the claim form being rejected, denied. So again, we are going to prevent ourselves from being in this situation. Another thing, you're gonna collect copayment, remember. So you're gonna make sure that you cover all the preliminary, questioning before you actually, put the patient in the doctor's room, because you have to do all this preliminary information collection and verification before you do that. Every single time that a patient comes in, not only we do all these preliminary verifications, but we're going to start a new encounter form with this patient. Remember, new encounter form, because it's a new visit, new charges, new services. Now, this new encounter form, we're going to use it to complete the new claim for this particular visit. But if we don't verify that the patient is currently active with insurance, then don't look at the expiration date of the card. No, you have to enter the system and enter the ID of the person and generate a proof that the patient has or doesn't have coverage for the particular day. Oh, good to go. Yeah, expires 2050. No, that doesn't work. So again, do the due diligence every single time that you encounter this situation. So otherwise, we're going to have a problem. So I mentioned this already, and I mentioned this like 100 times. Encounter form needs to be generated for each patient's current visit. So every time that a patient comes in, we have a new encounter form. We have new progress notes. We have new collection of information, new procedures, new, meaning something that is going to be done on that particular day. So if it is paper-based, then you're going to have to get the form, the encounter form, and place it on top of the chart in the front of the patient medical record. So when the medical doctor is going to complete this form, they have it right there in the medical records. It has to have a new progress note and whatever else the medical doctor needs for the particular interview with the patient or visit, so to speak. So again, it's very important that we do that. Now, I mentioned before in other chapters that the medical doctors have a desk in their office. So we usually have all these forms there, but they just make sure that the forms are there. So they don't have to be calling you to bring this paper at the last minute, because that's a waste of time. So that's basically what it is. Remember, you have to escort your patients from the waiting area to the designated exam room where the doctor is going to examine them. So instead of telling them, go to room this, go to room that, patients go wandering around, they go into the wrong room and something else. Just make sure that you take a little time to do that. That's part of, the protocols. So let's talk about now managing office insurance finances. So whether you are new or a established patients, we are going to be using this particular terminology because we're going to be using these different codes. Remember, in order for us to be reimbursed, as I mentioned before, we have the billing department has to translate everything that the doctor wrote in the counter form into codes, into numbers, or combination letters and numbers, whatever the case might be. So we're going to have something that is called CPT codes. C stands for current P stands for procedural, and T, terminology. So current procedural terminology. But we don't say all that all the time. We usually set CPT codes and healthcare common procedure coding system that we usually call the HCPCS. Now, HCPCS can be level 1, level 2. Level 1 is the same as the CPT codes. The level 2 of the HCPCS has to do with procedures that are not within the CPT. They go beyond that. So that's basically what it is. So ambulance services is not covered by the CPT. It's covered by the HCPCS level 2. If you're going to give the patient a wheelchair, it's not covered by the CPT codes. It's covered by the HCPCS. So some of the equipment that we give to the patient that is large equipment is not covered under the codes of CPT, because covers for CPT are kind of small, more routinary codes. The other ones goes a little beyond, because going to the emergency and using services from the ambulance is not a routine issue, right? So those goes to the HCPCS level 2. Now we're gonna have these codes for diagnosis. That's called the ICD-10-CM. Now, you need to know CPT, what CPT stands for and what is good for. What do you use then? Remember, CPT, current procedural terminology. This is for procedures that we regularly do to the patient when they come to the office. They're not gonna ask you for the HCPCS, like what it stands for, or what it is covered within these codes. But the HCPCS are gonna be asking something else that I'm gonna tell you later on. So I don't wanna give you too much stuff right now, so you can't keep up with all of that. But no, CPT codes, regular procedures, routine procedures, we use CPT codes. Now, ICD-10-CM, this is for diagnosis. You need to know this. This is an exam. You need to know, they're going to ask you. The patient diagnosed the patient. I'm just making it up. It's similar. They resemble the questions. Patient is diagnosed with diabetes. Which of the following terms you're going to be using? Then you said ICD codes, because the ICD, which stands for I, international, C, classification, D, disease. 10 is the new version. So every 10 years, we have a different revision. New codes added, old codes, some of them removed. We don't use it anymore. We add new stuff and we remove things that we don't need it because they no longer work. So every 10 years, we have a different version. So in 10 years, this changed like 3-5 years ago. Now, in 5 more years, we're gonna have ICD-11-CM. Remember, ICD stands for International Classification of Disease. 10 is the revision, is the year in which the number of books, let's say, that this is the latest one. The revision that we did was number 10. What is this important? Because when you are learning coding, and if you use revision that is not 10 at this moment, it's not good. You cannot use a book with codes from ICD-9-CM or early versions. It has to be the latest version, because many codes have been changed, have been reviewed, have been added other digits to it. Things change all the time. So we cannot use the same book. Says, oh, well, I'm not going to buy this book every single time that this new version comes out. Diabetes is diabetes, hypertension is hypertension. So nothing. No, certain things change. And you have to use the latest version, period. C stands for clinical, and M stands modification. So again, this is for things that are modified. Things change, as I said before. Conditions change. We have diabetes back in the days, but we have diabetes type 1, type 2, but now we add diabetes that are caused by this condition, by this other condition, and so on and so forth. So we have different things that we can classify with these codes. So for that reason, we have to use the latest version. So remember, if the patient is being diagnosed with a condition, what codes are we going to use? The ICD-10-CM. It's not ICD-9 or A or anything else. It has to be the latest, which is 10. So that's basically what it is. Now, for services, remember, services, which is evaluating the patient when the doctor talks to the patient, interviews the patient about the condition, determines to order these tests, evaluates the heart, the eyes, the muscles, anything that the doctor do to determine what is the diagnosis of the patient. We call these services EM, which stands for Evaluation and Management. So that's different thing. And procedures, whether regular procedures, we use the CPT codes, or if our procedures or equipment services that are beyond regular services, then we use the HCPCS. That's basically what it is. So once again, then after we charge services for the patient, we're gonna add these to the accounts receivable. We're gonna add these to the financial files of the patient. So everything that we charge is gonna go there. So that's how it works. Okay, so any questions about this particular set of codes? That's basically most of the codes that we use to bill the patient for services. So that's the job of the biller and decoder, particularly the coder. So all the services that the patient receives, meaning all the charges, we're gonna record those. We're gonna keep all this information, all this documentation in something that is called a ledger book. Now it's used electronically, so it's the place where you're gonna document all the payments that, no, all the services rendered to the patient, what money the patient has paid us, like co-payment or any co-insurance, whatever money the patient has paid us in advance, and then the money that we receive from the insurance, and we're gonna put it together, and whatever money after the insurance pay for the services that you are responsible as a patient, we're gonna add it later on. So that's basically what it is. So a ledger is just a document, a form that reports all the history of the patient's services, all the charges, with description, what was done. And we're gonna keep it on the side of the financials of the patient. So if we have any questions about what services were provided, we don't need to go directly to the medical records where it's the progress notes, the CDs, or looking for the encounter form, but we can go to the ledger book and read what services were offered, what services were provided, what are the charges, and again, we're gonna have information about how much money the patient paid us. and how much money the patient is spending after the insurance covers everything else. Remember that the patient pays some money every single time the patient goes to the office, which is a co-payment. So that's how we know the status of the financial accounts of our patients. I'm not a financial person, but that's how it works. Think about your bank statement. You record everything, it's everything on your account, whatever you pay, whatever money you receive, whatever money you using for this or for that particular item, that particular service, everything is described right there. That's a ledger that we use instead of calling them a statement from the bank. It's not a statement, call it a ledger. That's basically what it is. And every single time that we withdraw money or we pay someone or receive money, we're going to have a different balance in our accounts. The ledger works just the same, but in this case, it's for the patient services. So now you have an idea what is a ledger. So again, not difficult. It's, try to use common terms, so in common examples, so you can understand a little better most of the information that sometimes is a little more complex due to the fact that you are not familiar with some of these terms. But if we relate it to other things that we actually are familiar with, then it's going to make things a lot easier for us to understand. Each procedure performed must be individually described and priced on the patient's ledger account record. Remember, I mentioned everything, every single transaction. Let's put it that way, talking about financials. Any transaction that occurs with the patient, each patient is going to have their own ledger. You have your own account, you have your own banking statement, and you can go check your own account and you see all the charges, all the money that you deposit, all the money that you withdraw, payments, and whatever else, and you see how much money you have left. Here, we're going to know how much money the patient owes us. What's the balance? Because that's the purpose, to see how much money we receive. So this is done daily, every single time the patient comes in, because remember, this is part of the accounts receivable, and we need the money. And now we are worried about the money that we spend, that the money that goes out, the payable, but we need to have the money that we receive so we can pay the bills. Okay, so we're going to complete the insurance claim, post payments to patient's account. All of that, once again, is going to be there. Remember, all these charges after the patient's visit, immediately that encounter form, charge slip, or super bill is going to go to the billing department. If we have a billing department within our facility. What if we don't have a billing department with our facility? How are we going to do? Well, back in the days when we had paper that has to be delivered by someone from the office, bringing it to the billing department or whatever the billing office was, or faxing them, not faxing, or sending it by mail. Now, with the advent of, electronic medical records, everything is digital. So we're going to use this, the internet. We're going to use, the digital aspect of transmitting these documents via internet. So that's going to be a lot easier. Again, we always going to, keep documentation. If we're going to send this claim to the insurance, we must have supporting documentation for the claim. See, if you work in billing, you're going to know what information in which insurances usually want to see information. There are some insurance company that they know, they trust you, and they said, oh, we've been dealing with this person, we're not gonna ask. But sometimes some insurances, they see something, some charges, some services a little off, and they said, sounds a little fishy, so let's request for documentation. And they always gonna do that. So if you were there, so you're gonna know these insurances, this insurance in particular always ask me about supporting documentation. So I'm gonna send as much information as needed for these people. So I don't have to be, answering them back again and sending them information when I should have done this on the first place when I submitted the application or the claim. So that's basically what it is. Remember, if you do this submission of these claims manually, the doctor might have to sign them. But if it is not, if it is electronically, sometimes we have these signatures on file. Remember, that's what we covered when we were going over the claim, the CMS 1500. So now, again, the doctor has to have the signature on file in order for us to use it. It's not someone else creating that signature for the doctor. It has to be created by the doctor and authorized, so can be used. Otherwise, the insurance company is going to reject it. File copies of the claim and attachments in the practice insurance files. Remember, we have to have all these copies of all these claims that we send. We have to keep a file from them. So if everything or anything occurs until we get paid, remember, otherwise we're going to place it in a different file. Because we're going to keep files just like medical records. Files are claims that were submitted, claims that were rejected, claims that were denied, claims that are being appealed. We have all of those. So again, we're just going to keep records of all this information. Remember that these financial records for the billing the insurance company needs to be kept at least for 6 years, or depending on the statute of limitation of the state that you work in or where you have your insurance. So you have to keep documented all this information. This is considered legal. So in case of a lawsuit, we have to present this as well. Remember, those claims can be sent whether by mail or electronically. It was sent by mail back in the days. Now, 99.99% are sent electronically because it's faster. We're going to receive the money right away. And if there was an error, we're going to receive that claim, right away back to us, so we can do the correction, the pertaining corrections, and then send it back. So that's how it is. So technology is a very, very important tool nowadays. So let's talk about the insurance claim life cycle. So from the moment that we complete the insurance, we send it, right? So claim submission. Now the insurance is going to process it. Then the claim is going to be adjudicated. We're going to talk about adjudication because it says, what is adjudication? Then payment, if everything went right. So again, we can check the status of those claims. So pending status. Remember, we're going to keep in track because everything that it is electronic, we can keep on track right there in the system. We can see right there where is this claim at this particular time. So we know if there is anything to be done or any information to be sent, supporting information, because usually supporting information is the one that gave us a lot of trouble sometimes. Everything is okay, but they want to see proofs. They want to see evidence of why this test, this procedure was done. What was the necessity depending of the insurance that the client has or the patient has. So that's basically what. So we're gonna keep on track of all that. We're gonna discuss what submission, claim processing, claim adjudication, and finally the payment. But a lot of things goes in between, which is once again checking the status of the pending claims. Now, back in the days when it was paper, you know what the billing department has to do? They have to call. They have to continuously call. What is it that you do if you do not have access to that particular office? You're going to call. You're going to call to make an appointment. If you don't have your personal medical records or patient medical records, whatever you want to call, then what is it you're going to do if you want to make an appointment? You got to call the office or you got to stop by the office. But if you have the application, then you just can go there and do it yourself. And they wait for the confirmation. Oh, you want to review your exams? Oh, I need a copy of one of my blood tests. Well, you go to the portal, the patient's portal for the medical chart, and here you are, you have it. Instead of, oh, I have to go there, I have to sign a paper, so on and so forth. So the same goes for the claims, If you are doing manually, then you have to use the phone and call them up or sending an email. How long is that going to take? A lot of time. But electronically, we can see everything right away. We see exactly where these claims are at this particular time. So if the claim is denied or rejected, because remember, denied, rejected are totally different things. When it's rejected, that means that we can send supporting information that we can correct it. But if it is denied, means we're not going to get paid. We have to appeal. So think about someone who went to trial and they got convicted. Okay, you're convicted now. You've been sentenced. You've been given this particular sentence. Now, your attorney is going to appeal that, which means not that you're going to be free right away. No, they're going to appeal and see if they can lower the sentence, right? Now, in these cases, is, hey, provide more supporting documentation. Maybe it was an error. Now it was rejected for that reason. Rejection is different. See, you've been rejected in a job, but then they can call you back or you can apply again. But if you fire, that's like being denied. I said, forget it. Not coming here anymore. So it's kind of, similar terms in different scenarios. So that's basically what it is. So we're going to have the chance during all this processing, to try to get the money, to get these, account receivables in our office, because that's what we want. So let's talk about this claim submission, I guess. So this is a little graphic diagram, picture, I don't know, whatever you want to call it, life cycle of an insurance claim. So here is the submission. Remember, the billing department is going to submit this. It's completed. And it's going to send it. It's going to send it to where? To the insurance company. But guess what? It has to pass through the clearing house, which is when we're going to have the processing. And then adjudication. Adjudication means, okay, this is the clearing house, but this is Oxford. This is Blue Cross Blue Shield. This is United Healthcare. Oh, wait a minute. We're not going to send you to the same person. So adjudication means send it to their insurance company, send it to their insurance company, send it to the insurance company. This is Medicaid. This is Medicare. Okay, send it to the insurance company, That is adjudication. The insurance company has a department when they do all these verifications, clarifications, evaluations with the claim, and then they're going to say, but this is Oxford. We're going to send it to Oxford. Insurance company. This is United Healthcare. This is Blue Cross Blue Shield, Medicaid, Medicare. So we're going to send it to them. Think about the post office. I always relate this adjudication with the post office. So you go to the post office or to those mailboxes and you throw your mail over there. The mail from that box is going to go to the mail at the post office in this particular region. But this mail goes to California. Well, they have to adjudicate this mail with the group of mail that goes to California, to this particular state, to this particular town, to this particular zip code, right? So that's what we do with the claims. That is adjudication. Processing is just making sure that, the form is complete, that it has no mistakes, that we have all the information there. Now it's clean, moves to adjudication. And then adjudication means, hey, go to this particular insurance, and that insurance is going to decide the payment. So that's how it works. Any questions about this process? We're going to go through all this because it's written there. I just gave you a little, kind of overview because I have the picture right here. So you can understand it a little better. That's what I do all the time. So claim submission. So means, your office, your medical office, gather all these claims for this particular day or for the particular week. That was something that I was going to tell you before that kind of slipped my mind. Back in the days when it was done in paper, what they did was they collect this. I know this because I work again with one of my friends' office, and at that time they were doing billing, and I have to go over certain things because I was in charge. So not of the billing department, I was in charge with the medical part, and I learned all the stuff. I never thought that, it was going to come so handy for me because I never thought in my life that I was going to be teaching, and nonetheless, I was going to be teaching billing and coding. That's not billing and coding here, but at least insurance part of it. So I learned all those things. So because I practice, I never forget that. I have to review all these claims that were going to be sent because that were done manually. So I want to make sure that all of them are signed, that most of them are complete because they are paper, because we have prior situations in which all these claims were rejected. They always miss something. Something was misspelled, something was not coded correctly, something was not added, something was in a different block. So again, I kind of, scan the claims and scan it myself, not putting it in a scanner or anything like that. And then we collect them like for a period of 2 weeks. If we have lots of clients during that particular week, weekly, we got this, we put it in a package, send it to, via the post office, and then send it. Sometimes if the office was closed and we have someone, we just send someone, the delivery person, to bring all those claims because we need this to be processed right away because we need the money. Now that it's electronically, remember, it is a lot easier because we have something that is called a clearinghouse. That's the processing part. We will get there. So that's basically what it is. We have the claim that is complete. We send all the information and we send it out. Once again, it can be manually transmitted or electronically. Now, remember here it says it's gonna pass through a clearing houses. So cleaning houses, when we didn't have internet, cleaning houses were people, just like you and I, that they were, you know, reviewing uh these claims, not like I did. I was kind of scanning, running through it. They were detailed, go one by one. Can you imagine how many people they have to read, review all these claims and to make sure that all of them meet the criteria so it can be adjudicated and then paid? So that was a lot of work. Still, that was the clearinghouse then, people doing it. Now the clearinghouse now is electronically. It's a machine, a computer that reads, scans. Now it scans them, literally speaking, and verifying that all the information within these claims are complete, not correct, because the machine doesn't understand things, right? All of the things. It's just that everything is complete, then someone else is going to go to adjudication. And when they adjudicate them, they're going to have someone over there that's going to go over these claims. In their computers, they're going to just scan over, like I'm reading right here, my material. They go over and says, okay, here's all these blocks. Remember, there are 33 boxes or blocks. So they went over all those things. They were very experienced people. They are. So they blah, 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 goes over and says, fine. Then that's it. It's adjudicated. Now these claims are ready for payment. So that's basically what. So remember, clearinghouses are those parts or departments where the processes the claim. They do not determine whether it is correct or incorrect. If there is any mistakes and they catch it, for instance, the information is erroneous, you changed the blocks or you didn't complete one block, the clearinghouse returns that bill back to the sender, back to the billing company with a notation. It says they highlight the block that it was missed or the information was incorrect. So there were numbers, you put letters. There were letters and numbers, there was only letters. So something was missing. So those are the things that these machines can detect. So that's basically how it works. So then it's saying all these bills. Remember, this is the submission. It's just sending them for, approval, if you will. Electronic claim submission, because I already talked about it. But think about this acronym EDI, which stands for Electronic Data Interchange. Remember that when we talk about electronic medical records, we talk about this because this is the software application that allows this office from doctor's office, hospital, department, billing department, or billing department outside an external office that the company hires, whatever the case may be, it has compatibility with the software application with the insurance company. When we send in those, when we are submitting these claims, because if they don't have the same compatible, interchangeable, interoperable software applications, then we're not going to be able to communicate with them. So that's basically what it is. So that's the only way. I mean, it's very, very, very convenient for the practice and for the payments to be, reimbursed on time fashion. Or if we make mistakes, well, they're going to return them immediately to us and we're going to make the pertaining corrections, send it back, check the status of the claim. So that is the advantage of all these. So again, it says right here, it provides, for providers and clearing houses. So that is the most important thing because this is Remember, medical terms means in between the insurance company and the billing department, in between this medical doctor in this practice and the medical doctor in that particular specialty. So we can interchange, share information through the internet electronically. But we have to have a software application. That's it, in both location, both ends, that they are compatible, interoperable. Other than that, it's not going to work, right? So that's basically what it is. So I mentioned it already, particularly one of the most important things when submitting these claims is time that takes for this claim to be submitted, to be processed, to be adjudicated, and then to be paid. So it is very, very long process when it was done manually. Now electronic claims are a breeze. It's very fast. Back in the days, it took between 30 days and 90 days to get paid for services that were provided a month, 2 months, 3 months earlier. Can you imagine working this week and having to wait 3 months to get paid for that salary? So how long do I have to wait for the next of the time? Same time, every single time. So it's too much. Now we have direct deposit, isn't it? Back in the days, they pay us with a check. So it was a lot of hassles. If you didn't have an account, a bank account, what is it that you have to do? Go to the cashier, check something up. Oh, nonsense offices. And then you have to pay commission to these people for the money. Or deposit in somebody else's account. Oh, no. So think about it's just for you to understand the hassle, the troublesome that you go through when things are not done directly. So the turnaround time is definitely very short. We can get paid in less than a week for those claims. So that is awesome. Reduces claim submission error rates to 1 or 2%. If it is paper, that was like 90%. Now 1 to 2% claim submission errors. Why? Because it is digital. You type in it. You don't have to write things down, or you don't have to send it in paper, because it's a process that has to be done manually. Here it is electronically reviewed. So it's a lot faster, a lot easier. See, audits by the clearing houses, as the word implies, clearing. They are clearing, because later on, oh, here it is. We're going to talk about the clean claim. What is the clean claim? Because you will be asked about that, but we're going to get there. So audits by clearing houses. Audits is the review, the revision, the inspection of these claims prior to reach the adjudication, or the insurance company that is going to pay for. So before they went directly to the insurance company, they have some cleaning house people who were doing the job. Now it's a machine. Now it's through the internet that is clear. And then if it is errors, again, they send it back to you immediately. So it's like when you enter your bank account and then you enter the wrong one, and then immediately bounces out, says, oh, error, go look for the right code. So that's basically what it is. So it's very, very simple. So it says right there, it contains all the required data, elements. Oops, oh no, it was there. Elements needed to process and pay the claim. So that's basically what it is. Through electronic software, it is the best that have happened to any financial and any other, tasks that we complete. Can you imagine we can do this class because of the internet? It's electronically done. Other than that, we have to meet a certain place and give the class, and everybody has to be there. So technology is going miles, and this is not the end. It's just going, it's going farther and farther. So for the purpose of the claims, electronic submission of these claims are the best. So basically, that's what it is. So methods of transmission, internet. Of course, with the internet, we have the software applications, we have, the interoperability of the systems that we use that has to be compatible. But the internet plays an important role because if we have all these software applications, but we cannot exchange this information due to the lack of internet, it's not, doesn't meet the purpose. Claims attachments. Now, remember, when we talk about attachments means what is needed, supporting information, other information that might be required, medical evaluations for payment, these are supporting information. If I order this test, this procedure, I have to submit for certain insurances and certain types of services, particularly those services that are expensive. Yet support, have a documentation for necessity. Maybe pre-approval if, you have one of those insurances that are governmental. Has payment audit or review if it was something that was denied, if it was something that, we are appealing for. Quality control to ensure access to care and quality of care. Now, once again, depends on the insurance, whether you have, a assignment to your office, whether you are a participating provider or not. Because remember, they reimburse you differently. So that's how all these works. Any questions about this claim submission? Remember, attachment is anything that is needed for this claim to be completed without any hurdles or troubles. Claims processing. Now, again, the process is not done by the medical office. No, that would be by the clearinghouse and by the adjudication. So we have to do all these preliminary collection of information. Remember, verification of information about the patient and provider, because that's basically what it is. Remember that there are some claims that you can send with, with the wrong insurance, not being the primary insurance, or missing the secondary insurance. Think about this. If you have two insurances, one is the primary, the other one is the secondary, from the same insurance company, and if you submit only one, you just add one insurance, and the other one, you don't use it, then they will delay your claim, your payment. It's missing information. You have to submit the secondary one. Now, if you have two different insurance companies, one for the primary, another one, then it's different because you send the primary one first, and when you get received your payments, the remittance advice, which is the one that receives the doctor, saying what has been paid. Now, what is the balance? The balance you're gonna send it to the patient, or you're going to submit the other claim because the patient has a secondary insurance. So that's how it works. So that's the processing there. Claims adjudication, remember I already explained it to you. This is after it passes the clearinghouses, it was processed. The clearinghouses said seems like everything is okay. They went to the processing center, review it again. They said, yeah, it looks good. We have all the, attachments, any supporting documentation, we have it. So this bill is ready to adjudicate, to send it to the particular third party agency or insurance company so they can apply the payments. So that's basically what it is. Other than that, still they're gonna be they're gonna make sure that I'm not gonna pay this bill that probably was paid already. So that is not a duplicate. Because sometimes, remember, things happens electronically, something can happen. So they're not gonna pay you twice, because if they do, remember, they gotta do the reimbursement. You have to return the money. So you have to, another process. So again, that's all it takes for the claims adjudication. Remember, adjudication is you're gonna adjudicate to each insurance company these claims that were already processed, and they are considered clean claims. Remember, clean claims means that they have no errors. They are good to go. They are ready to be paid. So that's how it works. So remember, if you ask about what is a clean claim, it's a clean claim is a claim that has no errors. That's what is clean. That's it. You don't. Common data file is an abstract of all recent claims filed in each patient. Now, once again, this is just certain terminology that they use to determine, what are the whereabouts of the receiving concurrent care for this for the condition. Well, who saw the patient and what was the reason that this claim or these codes were added? Remember, they're going to do a little more investigation. It's like going through different departments and each one is going to do a little something. And like me, a little redundant, trying to cover something. I say that before, but here I have to say it again. And I repeat it over and over. So that's what they do. They want to make sure that when they pay you, actually this claim meets all the requirements. So that's basically what it is. So that all the codes are complete, that we are not paying for more than or less than. Remember, they do adjust things as well. If they see that a code was not completed, that needs a extra code to pay for a service that probably was qualified as, receiving more money, they're gonna let you know. So the insurance is not going to keep no money if, you kind of make a mistake. You remember, if it is an error, they ask you to correct it. So they don't keep anything for themselves. It says right there, allowed charge is the maximum amount an insurance will pay for a service. They would not go above any services. So that is when they determine what payment the patient or the provider or the hospital is going to receive. But again, if they see any codes that are a little suspicious because you upcode them or unbundle them, they're going to let you know because they're going to reject your claim. So you have to review it. But if you have a claim where you're saying codes that probably merits more to be paid, they ask you for extra codes. They're going to ask you. So again, but they will not go above the maximum amount that they contracted with the provider. So that's how it works. During the claims adjudication, deductible is total amount. Oh, claims adjudication. We're talking about what is it that the insurance is going to pay. Remember, the insurance is going to pay not the premium, the total amount of premium that you paid. No, I'm sorry, not the total amount of money that your services, your doctor is charging you for. They're going to get deducted. They're going to get deductible. They're going to get the copayment and the coinsurance. And after deducting all that money, they're going to know how much money they're going to send it to the provider. So again, we talk about copayment. Remember, copayment is the charge of amount of money that the patient has to pay every single time the patient goes to the office. If it is on the insurance card, they have to pay it. It's an obligation. They have to. Now, the deductible. What is the deductible? It's the total amount of covered medical expenses a policyholder must pay each year out of pocket before the insurance company is obligated to pay any benefits. So in simple terms, this is a percentage that the client or the insured, the policyholder, the patient has to pay. This is a percentage of all the money of the services that they receive that they have to pay. It's not the copayment, that's a different issue. It's not the coinsurance, that's another percentage. So before this claim actually is paid, you have to make all these deductions. Think about this. You are buying a car. Now, the deductible will be the copayment, the copayment, yes. Before you take your car away with you, before you receive services, you have to pay me this money. So that will be the deductible. Now, you are not paying the deductible. The patient do not pay the deductible to the doctor directly, like the copayment. No, you pay it with the amount of balance that the hospital owes that the insurance doesn't pay. So that's how it works. So remember, deductibles think about like the down payment, not the copayment, the down payment for your car. Because copayment is a different issue. Down payment. Oh, the down payment is $2,000, $3,000, $4,000, $5,000. Then you pay that, you sign all the papers, and you get your bank loan, things like that. Who's gonna pay for the rest of the car, and then you can take the car with you. So that will be deductible. And in order for you to receive services, the insurance subtracts the deductible, the copayment, and the coinsurance. 3 things. And after that, that's the money that the insurance is going to pay the provider. It's not like, oh, it is $100. Let's put it this way. Let's do the math. There is $100 that the doctor charges for the services provided in that particular day. Now, the deductible is 2%. So, oh no, put it 20%. 20% of 100, how much is it? $20. So how much the insurance is going to pay? $80. Oh, wait a minute. What about the copayment? But that is going to be paid by the patient. No worries. What about the coinsurance? The coinsurance is going to be 10% of this amount of money. What is the 10% of 80? 8. So how much you have to pay? 72. So this is what the insurance is going to pay the medical provider. Out of $100, the medical insurance is going to pay 72. Because the rest, the patient has to pay. because you didn't pay me the deductible, we'll remove it. That goes to you. So if you have a check on secondary insurance, then you're gonna pay the balance. What is the balance? $28. So who is responsible for these $28? The patient. This is what the medical provider receives because this is what the insurance pays. But the service was 100. You have to match this. So then the patient pays the balance. That's how you end up paying certain amount of money after, the insurance actually remove all these other, charges because the insurance is not going to pay. They said, no, I'm not going to pay your copayment. The copayment is yours, so you pay for it. And I'm not going to pay co-deductible. I'm not going to pay co-insurance. That's yours, so you deal with. Now, if you have a secondary insurance, that's the one who's going to pay your 28. If you don't have it, then you're going to have cash from your pocket. Understood? You guys understand now how these kind of terms, because these terms are a little, difficult when you are not familiar with insurance. So that's basically it. So it's a lot easier when you kind of give an example like I did now, because that's basically what you need to do. So patients usually end up paying always because there's always a deductible, there is always a co-insurance, and not always a co-payment. But if it has a co-payment, that's separate. You have to pay it because it's every single time that you go to the doctor, you have to pay that amount of money. But that amount of money will not be added to this. Now, let's say that this copayment, you didn't pay the copayment. So if you don't pay the copayment, you're going to add these $10, $25, $15, you're going to add it to the bill. You're going to add the copayment. That means the patient did not pay the copayment during this visit. Now you're going to end up paying the copayment when you get the balance. So you're going to pay it either way you're going to pay it. Okay. So deductibles, co-insurance, see? Co-insurance and deductibles. Co-insurance is a percentage that the patient pays for covered services after the deductible has been met. But the copayment, and the copayment, see? This is what I explained already. So that's what I gave you. The example of $100, that's the total amount of services that I'm charging, but I'm not gonna get all that money from the insurance. So the insurance is gonna say, oh, wait a minute, there is a deductible. Oh, wait a minute, there is a co-insurance and there is a copayment. See, that's how it works. Okay. Payment of claim. Now, just to close this for today, we're going to talk about once the adjudication is complete, claim is paid or denied. Remember, just because the bill passed to the clearinghouse does not imply, yeah, we're going to get paid. No, this is just checking for errors, omissions, you didn't write something there or you entered the wrong information and was not captured by the system. So if it's not captured by the system, it's captured as wrong. You're not using codes, you're using letters for something, they're not gonna understand that language. You don't put the right code, it's not gonna be understood. So that's one. So if it is complete, it's paid, no problem. The medical office, medical provider, the hospital receives the money. Finito. Now, here is another term. Pay attention to this, EOB. What EOB stands for? explanation of benefits. I'm gonna have it later on. Oh, it's here. Explanation of benefits. Because I write this down, I know. So if I leave out the definition, if I don't spell it out, it's gonna be difficult. Who remembers all these acronyms? I remember them because I'm familiar with them. But if you never seen them, how are you gonna remember EOB? What's EOB? What is RA? What is ABD? Oh, wait a minute. Do you know me? No, not good, right? So we have to spell them out. What is explanation of benefits? As the word imply, explains what services. This is a paper, this is a document that the patient receives. This is a statement, just like the bank statement receives. So the patient is going to receive this explanation of benefits by mail. And then you're going to say, okay, they're going to read it. And the first thing that it says, some values right there. What is this important for you? Because you're going to have it in your exam. They're going to ask you, okay, the patient receives a itemized document or a statement with all the services provided and how much money they pay the doctor for those services. So what is that? That's called an explanation of benefits, or EOB. This is the statement that the patient receives after the insurance have paid the medical provider for services. Remember, think about your bank statement. You're going to receive a bank statement monthly. Why? Because you need to know what is the status of your account. Think about that. Here is for the patient to know what services were provided. Now, what is this important? For two reasons. One, the most important one is that the patient has to read these statements and make sure that all those services and dates, procedures, services that they were done are actually real, legit. Remember, this is another form of fraud. Medical doctors, remember, one of the most common fraud is ordering procedures, billing for procedures that they were not provide. So during the explanation of benefit, this patient is going to say, oh, wait a minute. It says right here that they did an x-ray of my left arm or a CAT scan. Oh, wait a minute. I don't recall last time that they did this thing. So they couldn't call the insurance because they're paying for services that they did not receive. So the insurance want to make sure that the patient receives this statement so they can verify if those services actually were provided to them to avoid fraud. See? Now that is one of the good things. Now, what's the bad thing about this paper? Now the patients don't read carefully and they end up in the office screaming their lungs out, telling you, I'm not gonna pay this bill. My insurance paid for it. I never pay for this bill. It's your fault. I'm not gonna do it. And you're gonna say, oh, what is this person talking about? Well, this person received this and they don't read the whole statement. It says, this is not a bill. It is in the envelope outside and it is inside. This is not a bill, but the patients don't read that. And the first thing that they do, they go to the office to make a scene, to tell you why I received this bill, why I have to pay for this, because they don't understand it. So, because you don't know, you're not familiar, then immediately said, oh, that's none of my business. You have to pay it. It's your services. Remember, you sign the registration form saying that you're going to pay the balance or the money if the insurance doesn't pay for your services, right? Well, that's the wrong answer because you first need to see the document. Says, oh, can I see the document, please? Sure, here it is. Oh, by the way, Mr. and Mrs. Smith, this you don't have to pay this. No, I'm not going to pay it. No, let me explain it to you. You don't have to pay this. This is a statement for you to know that you received these services. Don't explain anything else. This is for you just to know that, the insurance pay the services that were provided to you last visit to your doctor. That's it. It says right here, this is not a bill, so you don't have to pay. You're going to be receiving this every single time that you come to the office, okay? So this is it. Have a great day. That's how it works. So now you understand that sometimes certain documents, if you do not understand them, probably you make the same mistake. Probably a member of your family makes the same mistake. They receive a bill and they get all, because they see balances in money. No, that's the money that they pay the doctor. So that's basically what it is. So for that reason, it's very important that you understand this. So the patient received this and the doctor is going to receive another document that is similar but more detailed.